I'll wait for them to take their seats. So before I move on to the next agenda item that I have for the board, and that is our COVID-19 health and safety update as is presented at each meeting. And Dr. Tigan's going to come forward to share that update. And of course, we'll take any questions the board may have for us once we conclude that presentation. Dr. Tigan.
Good afternoon, Madam Chair, members of the board, and Dr. Cashwell. Thank you for giving me the opportunity to provide a COVID-19 health and safety update again this afternoon. Today's agenda includes a reminder of the key COVID-19 prevention strategies, an update on our efforts to vaccinate and provide boosters to students and staff, an update on the COVID-19 testing efforts, and information about masking. This afternoon, I'm going to focus on 3 of these prevention strategies shown here. That will be vaccinations, again, testing, and masks. It is important, however, to note that throughout the pandemic, Henrico County Public Schools has been fully implementing each of these strategies and worked at layering these 9 prevention strategies to create the safest environment for our students to learn and our staff to work. I will start by sharing our past and current efforts around vaccination. As shared 2 weeks ago, one of the newest recommendations from the Virginia Department of Health is really to focus on vaccination rates within the locality. Henrico has been at the forefront of vaccination efforts since last January. Each week, the Health Committee monitors vaccination rates, and the staff work with the Virginia Department of Health to plan vaccination clinics that are accessible to staff, students, and families. As of this week, over 72% of persons 5 years and older in Henrico County are fully vaccinated, and nearly 40% of Henrico residents 12 and older have completed their primary series and received a booster. Efforts continue to provide school-based and community-based vaccination opportunities throughout the county. Beginning this week, the Virginia Department of Health is providing vaccinations at the remainder of our Title I elementary schools. These schools are listed on the slide, and only students enrolled at the school are permitted to participate in these vaccination clinics. Student vaccinations requires written parental consent and occurs during the school day without the parent required to be present. These clinics are being coordinated through the Virginia Department of Health with one of their partner pharmacies who will actually administer the vaccinations. Families at these 16 schools will be receiving information directly from their principal. In addition to the elementary vaccination clinics, later this month, our Virginia Department of Health partners will be providing additional Saturday clinics at Fairfield and Elko middle schools so that students and their families may receive their COVID booster if they completed their primary series at least 6 months ago. A new vaccination initiative involves our child care partners. The VDH and Henrico County Public Schools staff have collaborated with the Henrico Education Foundation, or HEF, Henrico PAL, the Police Auxiliary League, Activities League, and, Police Athletic League, and the YMCA to provide targeted vaccination opportunities for our HCPS after-school program students and their families. Each child care provider has worked with the Richmond Henrico Health Districts, School Health Services, and the Department of Family and Community Engagement to identify sites which are listed above and to schedule dates. These clinics will be held beginning this afternoon and extending until March 31st to complete both the first and second round doses at each site. It is also important to note that in addition to the Pfizer, they will also be offering Moderna and J&J primary series doses, as well as Moderna boosters. These clinics, while focused on the students and their families, will be open to community members. These will be walk-in clinics where the individuals complete a consent form provided on-site at the event. All persons under the age of 18 must be accompanied by an authorizing parent or guardian in order to be able to receive a vaccination at these events. Parents may provide consent on-site at the after-school program during pickup, as these clinics are conveniently scheduled during that time from 4 to 7 p.m. This is just one more example of how Henrico County Public Schools students and families are benefiting from the partnership between HCPS and the health department. Now let's transition to testing. The Test to Stay program allows students identified as close contacts through school and community exposures who are not fully vaccinated to continue in-person learning during their quarantine period if they test negative on COVID for COVID each day. Test to Stay requires close contacts to take a COVID-19 test every evening or every morning for 5 days after exposure. If the test is negative, they are allowed to stay in school. They must also wear a mask and remain without symptoms for 10 days after exposure. So that's masking and no symptoms for 10 days after day 0. HCPS has received and distributed the test kits to all schools, and as of today, the Test to Stay program is up and running. The other testing availabilities are take-home test kits remain available for our students. There are screening testing through the VISTA program, and take-home rapid test kits and prioritized PCR testing appointments for our staff, as well as community events within Henrico County. While we have remained committed to our layered mitigation as recommended by the CDC and VDH, we continue to consider when it may be warranted to discontinue or change practices related to any of these mitigation factors, including masking. The latest CDC and VDH guidance provides a list of factors to guide the decision-making process, and this is shown on the slide. You can see the focus on local transmission levels, vaccination coverage, testing, and monitoring and reporting of outbreaks. At each health committee meeting, these factors are reviewed. As community transmission continues to fall and vaccination rates continue to rise across all eligible age groups in our community, the committee has discussed recommendations for off-ramps related to masking that adhere to current CDC guidance. As a board, you have expressly focused on what transition plans for masking might look like, and at the last school board meeting, I was directed to come back today with a transition plan that would be responsive to the CDC's factors for local decision-making. The Health Committee developed a recommended transition plan, which was shared with division leadership, and based on input from leadership, the following slides represent the proposed transition plan for student masking. Here you can see the specific CDC factors to be used to guide local decision-making. Henrico County is currently in high transmission due to 492.6 new cases per 100,000 over the last 7-day period ending Saturday and reported on Monday, and 17.3% positivity on PCR tests. Over the last year, Henrico County, the Virginia Department of Education, the Richmond Henrico Health Districts, and Henrico County Public Schools have partnered to proactively address each of these decision-making factors. Only recently, we have achieved desired targets in the areas of vaccination rates and testing availability, and we have perfected our ability to identify linked cases and collaborate with the Virginia Department of Health to identify potential outbreaks. At this point in time, student outbreaks are handled as we would for any other communicable disease on a case-by-case basis in collaboration with the health department. As shared previously today, the percentage of individuals 5 years of age and older who have completed their primary vaccination series continues to climb even after reaching 70% 3 weeks ago. We are currently at 72.2%, and we have embraced every opportunity to reduce quarantine and isolation times through our participation in screening testing programs. While we have seen significant drops in Henrico's transmission numbers, the community remains at the highest transmission level. Given we have achieved targets related to testing access, vaccination rates, and management and reporting of student outbreaks, we are recommending that when Henrico County falls below 100 new cases per 100,000 persons and below 10% positivity on PCR tests within the past 7 days and reported on Mondays by the VDH and holds there for 7 days, the board consider transitioning from universal masking for students. I stress, this pertains to students. As the Department of Labor and Industry issued a standard which applies to all Virginia public school employees. The standard requires that the school boards, as employers, must require that all unvaccinated employees and fully vaccinated employees, when we're in designated areas of substantial or high community transmission, or otherwise at risk, employees wear face coverings or surgical masks when indoors that cover both nose and mouth. There are some exceptions, which include when an employee is alone in a room or eating and drinking. And at this point, I am happy to answer any questions.
Thank you for your presentation, Dr. Teigen, and beyond that, your continuous work with the health department, the health committee, our school-based health. I mean, the list goes on. You've really been the point person for all of this. So thank you for this presentation. I'm going to start with Mrs. Ogburn. Do you have any questions or comments for Dr. Teigen?
Absolutely. You know, Dr. Teigen, it's obvious. I think it's fair to say that we all want the same thing. We want this behind us. We want to move forward. We want normal. That's a word. I think we've all forgotten what that means, but we want masking behind us. And the question that you have so fully presented is, how do we get there? And so I'm glad to see the chart, but we also have to think of how do we keep schools open without compromising the ability to deliver instruction. And if you read our comments that were sent in today from our constituents and members of the county, and you read our emails, which we have all done, you talk to constituents, which we've all done, this is such a divisive issue. And if you could go back to your first slide, there are people who don't think we do these things. And I've actually had all the way back to the very beginning, that first one, because these are the 9 things that Virginia Department of Health, when you look at the latest guidance that came out and was updated on the 21st, these are the 9 things that the VDH recommends. And we've been doing them. We continue to do them. I've actually had people that I've talked to in the last week who say we don't do these things, but we do. And we've been committed to them. We've spent a great deal of time That's okay. We'll keep going. We've spent a great deal of time and effort and our staff to each one of these things, and especially our ventilation. Other counties haven't done what we've done with ventilation, haven't been able to. We've done these things. And there are people that think we shouldn't pay attention to the numbers that you just shared with us. There are people that think we shouldn't look at hospitalization rates, and then there are other people who think the data drives everything. So, the task we have is getting to the core of all of it, looking and listening to people on all sides of this issue. And so, as we have done from the beginning for the last 2 years, we've let the data and the VDH and the CDC drive what we do. And I don't see any reason to stop doing that. I just feel like the science and the data drive what we do. So a couple of questions based on the data. When community transmission is in the hive like we are right now, how does that affect our ability to do what we are supposed to do, which is deliver instruction? And so, for example, our absentee rates amongst our staff, is it still high like it was a couple weeks ago? Or we are seeing an improvement of our infection in our staff?
We've seen a significant improvement in our staffing level and our student attendance.
Okay.
But to your question, when we saw we're still in high, but when numbers were even much higher than they are now, what you were seeing were higher numbers of staff and student absences.
Right.
You're familiar with the number of unfilled staff absences. So absolutely seeing the correlation between high community transmission and those impacts on staffing.
Well, and that's one of the things I think we have to look at is, can we do our jobs? Can we deliver instruction to students? And as we are mandated to do, keep schools open 5 days a week, full time. And so I think about the bus drivers and the cafeteria workers and the teachers and the folks who are, but we've been able to bring those numbers down in our absentee rate, and we've been able to keep schools open with these 7 things in place, and they're masked. And so I think that's important. I mean, it's logical and fair to say that possibly that has something to do with it. Now, obviously, years from now, we're going to know more about the science and the data and how things, what works and what doesn't. But masking possibly, it can't hurt us, obviously, but it can help us keep school open. It can help us to do what we need to do. But what about when we are in high transmission? How does that affect our quarantine time, our number of people who are in quarantine or in isolation, as far as students and staff? Do we have a lot of kids, like a lot of outbreaks right now, and do we have a lot of kids and staff in quarantine? Not necessarily ill, but do we know?
The number of students that are in quarantine and are learning through the quarantine absentee label has decreased significantly.
Shows we're headed in the right direction.
We are. I mean, we have, since where we were when we came back from winter break to where we are now, you see the community transmission is down considerably even from where it was, even though it's still in the high. But also we see where our student attendance is up, our teacher attendance is up, and all those things are balancing out in the right way.
So I'm sorry.
I was going to say, and I think that's a great question, and Dr. Teigen has answered it fully. And I'd say related to that, when determining who a close contact has been through the contact tracing process, and as was pointed out, during the times when we were at the highest of high levels, the number of students in isolation and quarantine were far higher than they are now. That number is dropping as transmission in the community is dropping. But one of the determinants related to whether you're a close contact and would then need to quarantine is whether or not you are wearing a face covering. So while we saw high numbers of students and staff who had to quarantine, that number would likely have been far higher had students not been wearing the mask, because again, without that, that is one of the factors that determines that close contact.
Right. Well, and not long ago, the CDC said, based on latest data and testing, said cloth masks are really not very effective, but recommended surgical masks or N95s or KN95s. So are we now providing to our students surgical masks? Do they have them available?
There are surgical masks available in all of our schools, and our principals I've watched them as the students come in, handing them out to students.
So what the CDC is recommending is what we have available to our students. So their only option, it's not a case where their only option is to wear cloth.
No, they have an option.
So
wear
they can wear the
mask.
surgical mask that we're all wearing, that's recommended. And they're multi-layer, the surgical ones. So knowing that we have that in place, again, we're doing what we've been doing for 2 years, which is following the VDH and the CDC guidelines. And we've been listening to our health committee that Ms. Atkins and you, and we have so many good professionals that are a part of that, guiding us with the latest medical health information and the data. And so knowing that, I couldn't help but notice that 2 days ago, the chairman of the CDC, and if y'all don't mind, I will read the quote if you haven't read it. She said, as more states announce the end of mask mandates, and we're showing a chart that shows our way forward to hopefully that's where we're headed. She said, now's not the moment. The agency, this is Rochelle Walensky, told the news service Reuters, one day after 5 states announced that major changes in their mask policy, she made this statement: I know people are interested in taking masks off. I too am interested. That would be one marker that we have put much of the pandemic behind us. Right now, our CDC guidance has not changed. We continue to endorse universal masking in schools. And when the head of the CDC says something like that 2 days ago, and I see high transmission levels, and I see a way forward, there is a light at the end of the tunnel. I feel like we are in a good place. People have asked us to find a way forward, and we're doing it. We're doing exactly what we've been asked to do, and we find a way forward based on data and science, not politics, not personal opinion, not emotions, but we're doing it on the data and what exists in our community, not statewide, not nation, but in our community, this is what our schools and our staff have to deal with. The fact that we've got hundreds of people ill. And so our transmission level is so high right now. And I think we have to pay attention to that in order to keep people safe. But anyway, so I appreciate your information, I really do, and I'm curious to what other people have to say about this, but I'm glad to see it in a place where it's easily understood, a way forward.
And maybe I can put some context to it on data as a math person. When I think of the recommendation of less than 100 new cases per 100,000 persons, when you figure that out mathematically, that's about 15 people per day when you consider it as a 7-day total. So I'm hoping I'm doing the math right, but here on the spot. But it just to make sure that people understand, sometimes big numbers, when they're aggregated together, when you disaggregate them, are smaller, obviously.
Well, and we were there not long ago. And so we can get there again, but
we're not there now.
Right, we're not there now.
No,
and one
you're
of the
not.
things I'm so glad to see is our vaccination numbers. The CDC and the VDH both say our way forward is clear, and for those that can get vaccinated and choose to, that and that's for those that they make that choice, that will help us all get there. But so anyway, I appreciate it. Thank you. I'll turn it over to Mrs. Shea for the next person.
Thank you so much, Mrs. Ogburn. I'm going to go to Reverend Cooper next.
Thank you so much, Mrs. Shea. First, I want to say I concur with Ms. Ogburn that this has been a very divisive issue. And I do believe that we as a board and as a division have been dedicated and diligent in hearing and understanding the positions of persons on each side, as well as we have been consistent in following CDC, VDH, state laws, as well as the data, which have all driven our decisions. Again, not personal opinions, no politics. First question I want to ask is, can you clarify for me what the Health Committee's recommendation is in regards to will community transmission need to go from high to low to remove the universal masking, or what is the suggestion? Just need the clarity on that.
Right, and the recommendation is to go from being, really it's about numbers rather than labels. And so rather than going over having more than 100 new cases per 100,000 persons, or have, and because it's kind of both factors in, having a percent positivity of PCR testing at greater than 10 is when they're saying the recommendation from the health committee to leadership was that there would be mandatory masking. And so when we fall below that 100 new cases per 100,000 persons in that 7-day period, or below, and have to be below 10% positivity, that's when it would be appropriate to make masking voluntary.
Appreciate that statement of clarity pertaining to the two drivers that will determine when we would in regards to the time frame that needs to elapse in order for us to feel comfortable. So thank you for that. Second question is this: on slides 9 and 10,
Okay.
you listed the factors to guide local masking decisions, and omitted from the slides are the various state laws and court decisions that have been drivers of our decision making. In much of our communication to our staff, our families, as well as our community, we have cited SB 1303, the Arlington court decision, as well as we've been following SB 739, which we all know is a bill to amend the Code of Virginia that would speak to student instruction and allowance for mask optional for students. In anticipation of this bill passing and going into effect, either Dr. Cashwell or you, Dr. Tigan, or someone from legal, for the general public, could you speak to, and for myself and my peers, to what this means HCPS will legally be required to follow?
I'm going to attempt to answer that, and I couldn't hear all of it, but I think what you're asking is if the bill that's currently been introduced, past the Senate, is now being heard by the House, and if it were to be signed into law, certainly be watching the effective date. Traditionally, law goes into effect July 1. It's possible, we've heard that this could be expedited in some manner, and of course, we follow the law as we have always and would comply with such if that law were to come into effect, if that's what you're asking.
No, I appreciate that. I think there's been a lot of ambiguity around what is taking place in the various localities, plus what's taking place at the state capitol, not understanding that SB 1303 is still in effect. It has not been amended. It has not been changed. There is a bill that has passed the Senate that has not yet been signed into law, SB 739. And what are the ramifications and what are the requirements for us in regards to how it affects us? So I appreciate that. Next question is, understanding that we're still in the pandemic, Dr. Tigan, and our transmission level is currently high for our students and staff who are immunocompromised or have a weakened immune system and are experiencing fear and anxiety, trepidation regarding the anticipated mask optional decision. What kind of accommodations could be provided for them in order to continue to ensure their health and safety without disruption of their learning? Will there be an option for more virtual learning be permitted in context of that decision? Or what are our plans?
The reality is we will do what we've always done, which is work with families one-on-one individually to understand the needs of their child and then what options are available. So that would be an individual conversation with families.
Okay, so we want them to know that we are aware of what's coming down possibly, and then we'll do the best we can to accommodate them in light of the change.
Yes, sir.
All right, thank you for that. And then just quickly, last question. Mask wearing will still be required on all school buses all times when boarding, disembarking, and for the duration of travel. Despite any changes at our local or state levels, this still remains in effect until otherwise noted because of the CDC order requiring face masks on public transportation. We've already seen how some of our teachers and building leaders have been unfairly villainized for enforcing our mask policy, and one way we could provide support as we have to assist them in communicating that. For our school bus drivers and other pupil transportation staff, what will be the protocol for continuing to enforce mask wearing on buses, now that the option to not wear them on school property will likely be available?
Well, our buses still will continue to have masks available to students who come to the bus without them, and the expectation will be that they are wearing a mask when on the bus. So that none of those expectations will change. And we have seen other localities where they have, talking to colleagues, they have managed that quite well. And so we hope that would be the case with our students. But again, if there's a particular student that refuses, then that would be a conversation between the school and that parent or
Thank you.
guardian.
No, I appreciate that because this is not superseding what's already in place. That will still be in place, and we still will enforce it vigorously as we have in the past.
Right, we're required by law, yes,
Thank you
sir.
so much, Dr. Tigan. Madam Chair, thank you.
Thank you, Reverend Cooper. Ms. Kinsella.
Yes, I think I'll start out by saying all of us up here are parents. I think we all value choice as well. But as a school board member, as we've all said, we have different responsibilities and we must follow laws. And the law that we've been following is SB 1303. Like it or not, how it was written, I guess that's probably why they're trying to change it now. But, in the new VDH guidance from our new governor, it does say the goal is to balance, it actually says disease prevention, I'll call that health and safety, with the goal of providing in-person educational instruction. That's SB 1303. And then when you take into account the CDC piece of that, then you come back to the prevention strategies that I believe we've showed on slide 1 a few times today. I know at our last meeting, we didn't have everything in place yet. We didn't have the, test to stay kits, I believe, and I believe attendance and staffing for in-person instruction, not just to have folks in person, but to actually have quality instruction. That's a consideration. That is our job, to educate students. So that's a large component of our decision-making when we're talking about masking. And then the other number, which we have discussed in detail so far, is transmission. I have a question about the vaccination. Vaccinations aren't yet available for those under 5. I've heard from some of our preschool folks, what is the plan for our pre-K children going forward? I mean, pre-K isn't included in those who are vaccinated. If masks go away, what about our most vulnerable little people?
And I think you have to remember, if masks become optional, that doesn't necessarily mean masks go away. So families still have the option to put their child in a mask and send them to school that way. And I know on the horizon, I believe, is the vaccination for the 2 and up or the infants and up.
Right.
Again, that'll be a personal choice of families. But should they want to be vaccinated or not, they would still have the option in this plan to wear a mask.
Will we be adding those vaccinations to our sites as well once they become available?
Absolutely, and it may be that they're out of sequence to the point that we work to try to find particular sites at those schools, or the health department has a van that'll go around to certain schools that we might be able to do some clinics that way where parents could be there with the littlest kid,
Okay, because we do have preschool children in our buildings, yes?
We do.
Yes, okay, thank you. Does the general government side still mask in Henrico County?
Yes, their building, I believe, still requires masking.
They do, so they are requiring their employees to mask, and they're trying to keep their employees safe as well, right? So on the school side, that's just a point that we're trying to keep our students and our employees safe. For those people who my colleagues have already pointed out that think that this is political, I can tell you it is not on our part. That this is valuing health and safety for everyone in Henrico County Public Schools. As someone who's followed this closely with everyone in this room, do we expect the dashboard or the definitions and the metrics to change as they have before? Because I want to feel confident in the plan. We've been talking about having one since our January 13th meeting. But do we expect any of this to change, the terminology, like for cheese to suddenly move because maybe the state or someone redefines things? Because that happened last January. The dashboard changed completely, as did the metrics. So I just want to be really sure that
It has changed over time. Truthfully, that's why this slide is data-driven on the number of new cases and percent positivity versus relying on even levels, so that if things were to change, or, this is something that I believe the data will be available in a way that even if it's not shared in the same way, that we could calculate it.
and we could
that makes
still
sense.
protect our community.
Yes.
Okay. All right, I think that's all I have at this time. Thank you so much, Dr. Tigan.
You're welcome.
Thank you, Mrs. Kinsella. Ms. Atkins.
Thank you, ma'am. So many have worked very diligently to get here. Today is a good day. I feel good about being here. I got here an hour early because I was feeling so good about getting to this point. And there's two things, and actually I have a follow-up with Mrs. Kinsella's question. But I want to be certain that I heard you say that every single school have surgical masks available for everyone in the building. Did I hear that correct?
We have supplies available. A lot of kids, they prefer their own mask that they wear to school, but we have boxes of surgical masks. That's what we hand out when kids need a mask, or sometimes they come and request them because maybe they've broken one or gotten it dirty, and they'll come in and ask for them. They are all surgical masks.
And I'll point out, I just wanted to mention, the masks that we've had since day one are considered, they're disposable, one-time use, multi-layer surgical masks. And so they are multi-layer. And then we added, in addition to that, the KN95 masks for staff. We've also ordered the youth sizes, and we'll continue to make those available and continue to stock those for those who wish to use them.
Thank you for sharing that. I'm going to give you a list of schools that I've been working in for the entire month of February. And so I'd like for us just to validate that that is accurate. So I will give you that list.
Absolutely.
Because I'm seeing with my own eyes and working in some of the schools what we have. So I want to make sure we are
But I
being
can
true.
assure you we have them in stock. If
Okay.
for some reason they haven't been requisitioned, we can certainly follow up with the schools and make sure they have what they need.
Fantastic. Thank you for that. The other question, and actually, if you could just confirm, I want to be very clear with what this is in its current form, that mandatory masks remains the standard if all the criteria is not met in this matrix. If all the criteria is met in this matrix in the way that it's calculated based on the formula that Dr. Tigan outlined, it means that it has to remain that way for the past 7 days and stay there for an additional 7 days. So that trend has to meet the criteria based on the numbers that's defined in the formula for 14 days. Is that correct?
Well, it'll be a snapshot of what the new cases per 100,000 persons, or the percent positivity. That's a snapshot in time that's based on the previous 7 days. And then what we would do is at the next marker, the following week, we would look at then what happened over that second 7 days. So if you're looking at the 2 weeks in totality, yes, but it's really having the marker once and then making sure 7 days later, we're still at that mark or below it.
Thank you for that. I just want to be very clear. So once we vote and this goes, if we all agree or if the majority agrees, that if this goes into effect, I just want the general population watching, understanding what that means. And I agree that we don't want to get into what the formula being used, but certainly want to be very transparent in what the template means. So thank you, Dr. Tigan. And then I do have just an overall statement. I mean what I say when I say today is a good day. It's so refreshing to get here because a lot of hard work has gone into getting to a place where this can even be shared. And so there are certainly positive signs that this virus is moving from a pandemic to an endemic, which is what we want. I also want to thank the many that are serving, nurses, those within the health committee, but there's so many outside of the health committee, the nurses, the staff, all of our partners, our board of supervisors securing the funding and all these things that we've needed in order to get to this moment. This board, I think I'm confident in saying that this board absolutely aims to better serve students' learning and social needs while trying to keep families, students, and our employees safe in this pandemic. There are individuals experiencing mental distress and learning difficulties due to masks. Let's just be honest about that. There are. And there are also families in the need for masks for prevention strategies to make sure that they're protecting themselves, and they also want to protect others. It has been extremely troubling to be an American right now, to know that in times of crisis, division has certainly been a focus in some ways, because I was alive when we've had crisis and we unified, and we were at our very, very best. And I'm hopeful that we will get back to that. And again, history plays a role in this, understanding that the country that we live in, this soil that we walk on, was born out of crisis. And coming together to fight for it, to coming together not to fight just for the soil, but for human lives as well. Mine, yours, and all of us that are here today, there are people that aren't here today that fought in times of crisis so that we could be. They pulled together. I'm hopeful that we will get there again. I'm also excited because students and employees and all our stakeholders have an opportunity to digest this in its simplified form. It is much more complex than what many may know. But it was also complicated to simplify it so it's digestible, to be able to communicate it so that a third grader could understand. Those things are important. I also want just to display that it's good to have a tool to use to help remove some of the emotion. Every parent has the right to advocate for their child. So for me, it's not a question of who's right and who's wrong. It's a question of how do we move together. Then I also just want to take an opportunity to thank Dr. Cashwell for her professionalism throughout this, for her grace throughout this as well. As leader of our operations for the school division, I'm proud of her, and I just wanted to say that publicly. And so that was my collective response based off of our presentation today. And then I do have a specific independent response for Highland Springs, Sanson, and Varina. As your elected leader, I want to continue to guide us. We've been doing a wonderful job of being an example of how to behave during a crisis, how to conduct ourselves during a crisis, and how to look out for one another during a crisis. And it's important to also know that we continue to inspire and empower and think about other individuals' well-being. I know that our priorities includes more than face coverings. I know that it should not consume our whole conversations. So I just want to be clear that I have narrowed that focus and I have my eye on the prize in specific, unique needs for our district, for where I live. I know our human connection to each other is what's most important to us. I will continue to focus on that. And it is why we are definitely prospering amidst this pandemic. And again, in order to be very honest, I also acknowledge that most of what's happening is not because of COVID. COVID made it worse in many of these categories, but it's not the sole reason why we are having and experiencing some of the things that we have. I have received my priorities from you. I know to stay focused on bullying, on some of the negative disruptions that I am seeing. I have volunteered in many of these schools, whether I'm working in the office or monitoring a class. It's been a great eye-opener for me and actually seeing what supplies are in the schools and how are our children behaving and witnessing some of the experiences, not just of the staff and the students, but the parents that come into the building. So I just want to make sure that I do the best I can to reassure you that I'm paying attention to more than what's covering a nose and what's covering a mouth, because there's so much more work that needs to be done. I have received your emails about addressing racism. I am looking into that. I want you to know that creating avenues to tell the truth about history, I got it. If you're wondering why I'm talking about all of this during a health update, it is because all of these pieces, staffing shortages, right? Understanding the working conditions of our teachers. Teachers supposed to be there to provide instruction and provide a level of comfort for our children. I know that they are breaking up fights. I know that they are engaged in doing active shooter drills. I know that they have to deal with perhaps having guns in school. So the working conditions have to improve. I got it. All of these things play into the well-being and safety of every single human being in our buildings and the ones that surround it as well. So I'm going to close right now, and I want to thank my colleagues because I know I can be windy. So thank you for giving me this time. But I do want to close in giving you some tips. You said, Alicia, lead us. So that's what I'm going to leave you with, some tips to move forward. First, pay attention to this tool. You don't have to understand the numbers, but understand how it works so that when you see us move from high to substantial and your expectations are in a place where you understand that when you see it move down, it may not be immediate, right? Because you have the 7-day total 14 days. Also understand that when it's high, that's where we are in mask mandates. So share your voice with me regarding the tool, call me, email me, ask questions. Also, when you're thinking about when to consider whether or not your child needs to wear a mask, because we are going to get to that place of seeing smiles and feeling hugs, prepare yourself and prepare your children. Ask yourself, what are the medical circumstances of your child and your household? Ask yourself and have a conversation with your family about tolerance of risk. And what that means is, what is your comfort level with uncertainty? And what are you willing to risk? It's a tough question because oftentimes you have to have a loss in order to really understand, but ask yourself and have that conversation with your families. Also talk about how onerous is masking for your child. Some children are comfortable with masking. However, it's been problematic for other children. Oftentimes, it's been problematic for adults to watch the children. So have that conversation. And one of the most important ones that I hear from students when I am in the building is, what should they do if they don't want to stand out with wearing a mask? Or what do they do if they don't want to stand out by not wearing a mask? What can they do about it? So parents, I am begging you to have those conversations with your children. And if you are uncomfortable with the way your conversation is going, please seek a professional to help you. Whether that professional is in the school with a guidance counselor or your pediatrician. And so I close with saying, yes, today is a good day. This is an opportunity to move from a divided Henrico County to a unified Henrico County. We know more. We have more resources. We're understanding what prevention looks like. We have a tool that can help us make better decisions faster right now, whether we're talking about Omicron, Delta, and there's one other that slips my head right now, or whether we're talking about mutations of this in the future, because there will be. Let's pray that they're not soon. But this is a tool that helps us make decisions better, faster, and have a conversation about the tool. so that you understand in its form right now what it means if we agree to use it as it stands. So I'll close with that, and I'll pass the floor on to you, Mrs. Shea. Thank you so much.
Thank you so much, Ms. Atkins. All right, just so I jot some more notes. Thank you so much, Ms. Atkins, for your thoughts and also for your time serving on the Health Committee. And as you said, we have been working towards this for a long time, but I also know the Health Committee has been working on this for a long time. And this is not just something fresh they came up with in the last 3 days, like, oh, hey, let's think about removing masks. This has been something you've been, as a health committee, working towards for a long time. And I know it is tedious work sometimes, and it is long hours, and I just want to appreciate for your service there as well. For some of our families, this is the same thing I said when I opened up 2 weeks ago. For some of our families, this is going to not be enough. For some of our families, this is going to be too much, right? And so before we get into this specific matrix, I just had a couple other things I wanted to touch base with you on in terms of kind of health and safety and the general. Let's see. So parent volunteers.
Yes.
Has the Health Committee, or can I just ask that in future meetings at the Health Committee, can you perhaps talk and revisit about what parent volunteers look like in our building, when that might happen, how that might happen, what that might look like? I know we have that matrix, which I think is very helpful. Like, things with numbers and matrices are very helpful. And I think it's very helpful. We developed it quite a while ago, and things have changed about what we know about the virus and transmission, also about critical needs within our building and how parents could partner there. And so that's just an ask to be part of the discussion. I know we have quite a few parents who would be willing to help support within our schools and follow any mitigation necessary in order to do so. Second question is just if you can provide some clarity around quarantine. So we know the dates, we know all of that, but now that we're not doing as explicit school-based contact tracing, when would a student quarantine?
There are times in the school where, because of the connection with whether it's within a classroom or if it's in a time period or area where kids are on masks, they are still doing some, limited contact tracing, as well as we do it with athletics because we know they are close contact and they are not wearing masks the majority of the time. And so, but we also get reports from parents where there's quarantining from a community exposure, which has truthfully still been the basis of most of our cases of quarantining and isolation within our schools of our students have been related, and actually of our staff are related to community exposures. So if a parent calls and says, my child has been identified as a close contact to a positive case, then obviously we trigger into our quarantine practices. And we're finally at the point where that child, as long as they're asymptomatic and are willing to test daily for 5 days from that exposure and wear a mask for 10 days from that exposure, that we can keep them in school, which is a huge, huge thing, which is that fourth column that we are really able to minimize the impact of quarantine even more than we have. I mean, we've gone from 10 days to 14 to 5 to we have an opportunity to not quarantine kids. When we do get the information, could be a sibling as well. A lot of our cases it's in the house. And so there's that's the connection.
That's really helpful. And I actually have 2 follow-up questions that go different directions. So let me choose the quick answer, what I think will be the quick answer one first. You mentioned that as we've adjusted the quarantine, and I guess particularly I should be saying the isolation period. We've adjusted the isolation period, that it's 5 days, after 5 days, they could return, but they must be masked. And
Yes.
even if this matrix is passed by the board, voted on and passed by the board, it does not change that piece, correct?
Correct.
And can you give us a sentence or two as to why?
Absolutely. And just for refreshing, the vocabulary, it's not what we live every day. Some of us live every day, but most don't. Isolation is when it's a positive case. So they've had a positive test result, then they are required to isolate. We have reduced the isolation to 5 days, and as long as their symptoms are improving and they're fever-free for 24 hours, and they're willing to wear a mask all the time except when they're eating, then they may return to school. And if their symptoms aren't improving, if they're not willing to wear a mask, then they stay out for the 10 days. It reverts back to the 10 days.
And that
But
is-
parents have a choice as to what pathway is best for their child and their family.
And I think what you last said is so important, because we're not trying to put a scarlet letter on anybody who has, tested positive. This is what aligns with what lets us reduce the isolation period. And if parents are uncomfortable with it, they would have the option to keep their child home until they 10.
And Dr. Green, the health commissioner, has made it clear that even when masks are optional within a school division, they are not optional in this choice for isolation.
And this is the new health commissioner
new health
appointed by the new governor.
Yes, ma'am.
Okay, that was supposed to be my short question, sorry. My longer question was a little bit about the Test to Stay program. And so talking about access for families who are really trying to do the most responsible thing. So they have a sibling that tests positive. We know very often that transmission occurs within the house.
Correct.
And so a family that's trying to do the right thing in terms of limiting transmission. And so, but their other children are vaccinated. Could they still have access to the Test to Stay program to ensure that the siblings coming to school are healthy? Does it make sense what I'm asking?
Oh, absolutely. And while they can't have access to the Test to Stay, we can certainly work with the family to provide test kits for them.
Yeah, the Test to Stay program, as we're participating in and is implemented, is for a specific use case, and that would be for an unvaccinated. But remember, we also have the supply of test kits that we were providing before, should a student be identified as a close contact and so on. And so that supply could be leveraged in conjunction with the
So the
school
Test to
nurse.
Stay has specific requirements because of how the program is defined outside of Henrico County schools. But if a parent was truly trying to do the most responsible thing, they could contact, who should they contact? Their principal about
They should reach out to their principal
access to those tests?
or their school nurse and just ask. And we will make sure that they have what they need. It just doesn't count as the participating in the Test to Stay,
Yeah,
but that's
yeah.
really not the point. The point is keeping kids in school
Right, wonderful.
and families being honest.
I saw, did I understand that the J&J will be part of the vaccine?
Yes, and I do believe that I have an email from earlier today that they're going to offer the J&J not only at the child care sites that are open to the public, but also, I believe, on the Saturdays at Fairfield and Elko Middle Schools.
Do you know why it was chosen to include that vaccine, even though we see some lower efficacy rates around it?
I think it's because the fact that that is a one dose and that provides your primary series. And so for some individuals, making that commitment to one dose and versus two
When
doses 3
access
weeks
is a
apart.
challenge,
Access,
then, yeah.
that's why we've had such success at our Title I schools, because we've eliminated the access, issues that some of our families had.
Yeah, so important. Thank you. Have we in general seen school cases parallel community cases in terms of as we see increases and decreases? I know I've got the snapshot of what, I just haven't written them down to graph it.
I would say that the contact tracing probably, that when we had the number of close contacts, that more mirrored the numbers than the actual positive cases. But yes, as community numbers go up, our students and staff are not isolated in our schools, so the numbers go up with the number of positive cases that we have within our schools.
Thank you. And then we'll get to the most important slide of the day. And I have so many thoughts on it. It could be its own meeting. So I'm going to try to be really limited about it, but I want all of our constituents to know that, we have all read the hundreds of emails and studies sent, and have you thought about this? Have you thought about that? And I would love to ask all of those details, but we would be here a very long time. So I'm going to try to parse it down a little bit. When we look particularly at waiting until we get to the 100 cases or the substantial, or however you want to phrase it, how does that dovetail with the recommendations of health officials and experts around masks?
The current CDC guidance is aligned to masking with insubstantial transmission. So it does align with that as far as what the current situation is, but situations have changed, and that's been a change in the last probably month.
And I would add to that, and I think something particularly hearing from health experts on this and looking at both the VDH and the CDC guidance, when they talk about local decision-making factors, there's more than one, and community transmission isn't the only one. It's the others you're seeing on the screen, and any combination of those vary based on the locality. And I think where you're seeing, perhaps if you were only focused on transmission and all of those other things had yet to be achieved, there might be more concern, even watching community transmission go down if there weren't, high vaccination rates and there weren't the availability of testing. So I really believe that those do go hand in hand as they're presented in the CDC's recommendation of those factors for decision-making
Thank you.
at the local level.
And as, in general, as our local practitioners and our local experts have been working with you all on the health committee, in general, I'm not going to ask for every single person around the table, but in general, do they believe it's prudent to wait until we get to this under 100 number?
Yeah, they would be very uncomfortable going back in high transmission.
And these are local to Henrico that understand what our local communities look like.
Yes, and opinions obviously vary among the health committee, even though some can be are all if you look at even the health officials, but it was really looking at where we are in regards to our other factors. The vaccination rate is extremely important because we know that the likelihood of having a breakthrough case is much, much less than having a case from someone who's partially or unvaccinated. I mean, the numbers are staggering as to what that impact is.
I believe last time I looked for the state of Virginia, it's about 20%. Or excuse me, sorry, I should say that unvaxxed individuals are being infected at almost 5 times the rate of vaccinated individuals.
Partially vaccinated are about 5 times. Unvaccinated are about 36 or higher times. So, it's a combination of, again, it's a combination of factors. It's that not one thing taken in isolation. The fact that we have just as of today really fully provided that screening testing. I mean, having that in place is important to what the impact is of the totality of the factors you're seeing there.
That reminds me back to when we were talking to Dr. Avula almost 2 years ago, anyway, and he said, we kept trying to understand, because this was the beginning of the pandemic, we kept trying to understand, well, just tell us just tell us what number we need to be looking at. And he kept saying, it's a contextualized decision. Like, it's a contextualized answer. And I think this points to it. But for, you to say that our local experts truly feel like all of these pieces are important, it's important for me to hear.
And it's important that we have made the progress on them, and that this the progress on the fourth metric, the fourth factor there be met.
Yeah. Masks have been an important part of our layered mitigation, but we have learned a lot about this virus and transmission in the last 2 years. Also, the virus has continued to change in the last 2 years with different variants. And so, I think all of my colleagues were exactly right on, I think what is important, we all know that we want to move forward. And I think what is so important about this slide is it gives us quantitative ways on moving forward, right? And what that looks like, and it takes away some of the anxiety, I believe, that Ms. Atkins was just talking about for families that feel one way or the other about when might this happen. I don't know. Here it is, right? Here's how to know, here's how to prepare, here's how to not feel like it's dropping from the sky. But I would be remiss if I didn't point out that masks come with their challenges, particularly for some of our students, and in a whole myriad of ways. I'll just focus briefly on instruction, as I've had the privilege to do some co-teaching this fall with some extraordinary teachers. But specifically, some of the places that I saw masks being a challenge were with our unconfident learners. Those of us who have been in a classroom and, we'll ask a question of a student and they answer timidly. And so we kind of, have them repeat, and then the rest of the class can hear and to be part of the conversation. With masks, often those unconfident learners, it requires the teacher walking over right to their desk to be able to hear them, and then repeat what they say to be part of the conversation. And while that's okay as a temporary measure, it's not affirming to the unconfident learner in the classroom to, And so also for our beginning readers and, learning phenom awareness and sounds and that sort of thing, it's so hard with a mask, and for our multilingual students who really depend on being able to see facial cues. And so it's important that we move forward, but it's important that we do it prudently and safely. And I appreciate the work of the Health Committee to figure out what that path looks like for Henrico, for our locality. From a procedural standpoint, this is a recommendation from you, correct, Dr. Cashwell?
Certainly, at our last health and safety update, the board did ask that staff take a look at what I think off-ramp was the term used, transition plans the term here. And so while it's certainly something we've actively been discussing all along and we've been focused on those local decision-making factors, this is what we've brought forth for your consideration based on the board's request at the last meeting.
Thank you, Dr. Cashwell. And seeing as we...
Madam Chair, before we move, if we're going to move towards voting, I just had 2 more questions. So I don't want to stop you midstream.
I was just going to ask kind of where everybody is on, but if you have some other specific questions for Dr. Teigen, I'll defer to you.
Thank you so much.
Yeah, absolutely.
I certainly didn't want to stop you midstream because you were on the flow and you're doing a good job.
Yeah, go ahead.
Yes, and so a couple things that I just want to get clarification on is if you could just define student outbreaks and community outbreaks.
Well, student outbreaks are actually students that are enrolled and attending our school in person. And I should say that it's attributed to a school, I think, which is what you're really asking, a school outbreak versus a community outbreak. And a school is when we're looking at cases and that there are links between at least 3 cases over a 14-day period that is epidemiologically connected. They're connected that way. And in a community is when we might have 1 or 2 positive cases in our school, but the other one is outside the school, like maybe it came from outside. And so when the health department researches these multiple cases and look for connections, it may be decided that really this one community case and these two inside, or even three inside, maybe at different grade levels, different classes, that really the connection is maybe through church, that they all attend the same church, and that's where the connection is, not in school, because they're not connected in school for that exposure. And so if it's tied to the community, then it's considered a community outbreak. If it's believed that it's happened in a school because of the proximity of the students and proximity of the cases in time, then it's attributed as a school outbreak.
Thank you for sharing that. I just want the public to understand, because community outbreak is not listed as a weighted factor in decision-making for our tool. It is student outbreak that is used, and that's so important. Also, actually, let me back up on that, because community outbreak is tied to transmission, but I won't get into that, but just be very aware that student outbreak is what we're targeting on, and while it's unique to each individual case, it's important to understand the weight of these things. The other piece is if you could share the process that our partners use in determining outbreaks.
They look, and this is where, I can speak to the school side more so than the community, but within the school, if those in our school, because we are still tracking positive cases, if we see that we think there could possibly be a connection between cases, like in the same classroom, on the same bus, and then research says they're seated in proximity on a bus or whatever, then our student health services reaches out to the epidemiologist at the health department, and they say, here are the cases, we're not sure, and they investigate them. And so then it's truly determined by the health department as to which cases are epidemiologically connected within that 14-day time period that they would consider it an outbreak based on where the exposures happened.
So I'll share for me, my biggest concern are around understanding the time frame and how long it takes to define outbreaks, student and community, because based off of our matrix, there is I'm going to say 14-day, but so that folks understand, I'll say 7, because that's what was listed on the slide. And if the amount of processing time is outside of that, I want to better understand, and Dr. Cashwell, you can weigh in. We had a conversation about this, because I am super excited about where we are, but that's my biggest concern, understanding the weight around outbreaks, because it's changed so much. So understanding that it also has the potential to change. So right now there's 3 variants. I think it's Beta, Omicron, and Delta. And so because all of those 3 things are in the mix, not so much Beta here in Henrico, but the tool, I'm hopeful that we design something, not because of where we are today, but thinking ahead, so that if we're in the position again, that this tool will be adequate and accurate enough to allow us to make better decisions faster. So with that said, my expectation here, and here's a big question, if you're comfortable, both of us are on the health committee. But where I am not is on the division leadership team conversations to get to this place, to get to this design. Do you feel confident in the community transmission, in the student outbreak and community outbreak process, that it provides enough time to meet the 7-day trend that we put in here? Do you feel confident that with staffing and everything and thinking future, that 7 days, it will be able to do that? Because what I don't want, we've come so far. is if we all agree and vote on this with that 7 days, to turn back around in 2 weeks, realizing that the processing time does not allow for 7 days, that we have to go back and say something different. That's my only area of concern.
I think I can speak to that some, and I know Dr. Tigan will fill in where I miss details, but I think one of the positives related to the confidence for that green check under the outbreak column is that it's a very case-specific, school-specific, classroom-specific, easy-to-mobilize process. So for example, whether the community transmission is high like it is today, or were to be at its very lowest point, and there was to be an outbreak in a classroom, there were 3 linked cases, we would work with our health department like any other communicable disease, and it may be that they go virtual for a period of time. That's something we can enact quickly. We're doing that now. There are times when a particular classroom may have to shift not to an in-person format because of that outbreak. It's something that's very specific to where the outbreak is, and would continue to happen no matter what we would see in transmission level. And because that process is in place and localized and specific to the outbreaks, that's what gives both the leadership team the confidence based on the recommendation that came forward that, we are nimble and that process for outbreaks won't change. And even still applies outside of the Omicron. We've seen rotavirus and the flu do this a couple times, and it's hard to look backwards that far, but it had been the case. So feel confident in that process of managing and mitigating outbreaks at the local level.
Thank you for that, Dr. Cashwell, because while we'll have a decision-making tool to help us, I also want to be clear that there are some things specific maybe to one school or several schools where this may not apply. And I just want to be confident in putting that on the record, that if we are in a situation where something comes or we remain high and we have a school with a larger outbreak, and perhaps it's outside of that window that we've said here, that local principals and administrators have the opportunity to make a decision that may be different from what's here. Is that accurate?
Yes, and I think when, this is generally applying to the idea of when, and what the board has asked of us is to talk about when would we move away from a universal masking. So exceptions to that are, for example, Dr. Tigan mentioned isolation. If you are a positive case, if we're following the isolation guidelines from Virginia Department of Health, if the student would return after 5 days and is symptom-free, they would be required to wear a face covering during that next 5 days. So absolutely, those pieces of mitigation, the handling the outbreaks, dealing with specifics around isolation still remain and are part of the mitigation strategy in its totality.
Yeah, and I would just like to clarify, like with outbreaks, that's a decision that's made with our school health services in collaboration with the Virginia Department of Health. Those are not decisions made by school administrators. It it must have that medical epidemiologist view.
Thank you for that, because there are communities that don't have readily available services or hospitals. And so it's important to understand that there may be exceptions to this rule. There may be communities that, particularly mine, where the internet is not working always properly. And so I don't see the internet as a luxury. I see it as a necessity to get communicated with and to communicate out towards and understand. So I just want to be very clear and very aggressive that for some communities, this may not work. And so if that is the case, that Henrico County Public Schools will be sure to do everything that we can to accommodate what we have in this tool in its current state, and make sure that, of course, what we all want, again, as I say, to see smiles and feel hugs. So thank you so much.
Thank you, Ms. Atkins. Our last mass matrix, I believe we voted on in August. And because we took a board vote on that, I believe we need to take a vote on this matrix if this is how we want to move forward. So I am, what I want to ask of each of my board members, I am not asking at this moment for you to take a vote on this. What I'm asking is if each of you is ready to take action on this matrix. And if it is the will of the board, then we will move forward and vote. So I'm going to ask each of you if you are ready to take action and adopt this matrix and move forward with this. And then if you are not, what do you need to be ready to do so at the February 24th meeting? So that is my question to you, Mrs. Ogburn.
Mrs. Shea,
Oh, yes.
if I may ask
Yeah.
a question, would you all be voting on basically coming back, using this matrix as a tool, and once you have all of the information, that would trigger you all to come back and make a decision about masking later? Does that make sense?
No.
What are you?
If it's the will of the board, I'm asking if it's the will of the board to adopt this matrix, then if it is the will of the board to adopt this matrix today and give Dr. Cashwell the authority that when we meet all these green check marks to enact optional masking.
Okay.
Does that make sense? So I'm taking a straw poll. Are we ready to act on this? Do we need to wait another 2 weeks? And in those 2 weeks, what would you need?
I understand now. Thank you so much for that clarification.
Thank you, counsel. Mrs. Ogburn?
That was going to be my caveat.
So Megan, excuse me, are you saying that what the action, the action that the board chair is asking us to take, is that permissible?
Certainly. So you all can take action today and say, we want to approve this matrix as our tool and guide for our superintendent, and we ask that she use this in determining whether, when to stop universal masking in schools. You also, I think the reason I asked the question was because I thought Dr. Teigen said the recommendation was that the board consider transitioning based on this matrix. And so I just wanted to know and be clear on which direction you all were going, whether you were asking your superintendent or just what exactly you all were considering taking action on. Does that answer your question, Reverend Cooper?
It does. I just wanted to be clear so that we can make sure that we are in alignment with what our capabilities are in that context. Thank you so much.
Ready? Just checking. No, that was actually going to be my caveat, so to speak. I am ready to vote on this, but I would like to give Dr. Teigen the authority, Dr. Cashwell, I'm sorry, because as Dr. Teigen said, this 7-day period can fall in between our meetings, and having to wait, that's one of the issues I've talked a lot about with constituents over the last few days, is that we only meet every 2 weeks. In April, we have one meeting. There could be a period of time when we are not meeting, and I don't want us to have to call a special meeting, notice that, get this done. I'd like to give the authority to the superintendent to act on our behalf, as we do on many things. And so, yes, I'm ready to vote on this.
If I may, Mrs. Shea. So the only caveat I would say is that my understanding is Dr. Cashwell would have the authority to make a decision based on this matrix, considering all of the factors. So as Mrs. Atkins had talked about earlier, she might say, I'm going to end universal masking with the caveat that this school still needs it, or that there might be other additional factors that she take into consideration, but that this matrix is the trigger for her to then make a decision based on all of the data. Is that what you all would, just to clarify?
Well, I mean, in other words, Ms. Watkins, what you're saying is if there were exception, for example, let's say there's an outbreak at a certain school, Dr. Cashwell would be authorized to say that it would be all the schools are going to go masks optional, except for possibly, based on the data, this particular school, if there's an outbreak.
Correct. Or in the alternative, if all of this data were true, there were 4 check marks and it was a Friday, whether she would say, well, we will start this on Monday, we'll start it next Friday, we'll take 2 weeks.
Well, that's
Is
up
this
to-
a trigger that automatically, or is this something where you're saying, I want her to have the ability to consider and make a decision about what's best based for the school division?
I think the intention is, and this could be, if needed, a conversation now on the board members. I think we need to take this each step. Like, are we ready to vote? What's the vote? Does Dr. Cashwell have the authority to enact it? I think those are our steps.
So I think first, if I might,
Yeah.
as I'm hearing it, Chair Shea, you're trying to garner whether each board member individually is comfortable with this first. That's your first question.
Yeah, like,
As
do you
it
have the
is, or is
information,
there
do you have
something
the
missing?
information you need to
Or is
vote
there
on this
something not
today?
here
Or
that
is
you
there-
would, that further you'd need from administration?
Yeah.
Well, and Mrs. Shea, if you don't mind me adding, this is what our constituents have asked for. They have asked for data, they've asked for a metric. What metric are you going to use to make a decision? This is what we're giving them. And we're saying this is the metric that the VDH and the CDC, the guidance that we have makes us comfortable to make this decision. And if it's in between board meetings, Dr. Cashwell is going to go ahead and make that decision without having to wait for us to meet, then, but this is what folks are asking for. They're asking for numbers, they're asking for hard data. How do you make the decision? So this is what it is.
So the first question that we're dealing with is, do you have enough information to make a decision on this slide today?
Me, yes.
Okay, Ms. Ogburn says yes. Roscoe Cooper, do you have enough information today to make a decision on this slide?
So for me, I'm just kind of trying to process it all from the perspective of, I get the defined metrics that we're going to look forward to, but with the CDC guideline currently, because nothing is mentioned on the slides about CDC in regards to, like Ms. Auburn mentioned earlier, what she did state in regards to universal masking still recommended. What impact would their position have on our decision to make a change? Would we make that decision if they decide to still stay CDC recommends masking but these metrics are met? Would we say, well, we're not going to follow CDC, but we have met these metrics, so we're going to remove universal masking? That's the question I raise.
Is that a question for just Dr. Teigen or just a?
No, to
But that
either
just,
the two.
okay, that's your, so are you saying that you are not,
So what I'm saying is, so nowhere on our metrics is anything mentioned about CDC. Nothing is mentioned in regards to VDH in regards to that. This is local based upon us. So we got it on our 9, but I'm saying it's not on on the 9. What does the CDC's recommendation, how does that impact our decision to off-ramp? That's my question.
And I do think it is aligned with what the current CDC, I realize what a statement from someone versus what is on the website as the guidance, there is a disconnect there.
Doesn't the guidance right now still state that universal masking is recommended by the CDC?
It says in schools during high transmission. And so this is not indicative of high transmission.
Right.
And so in that way, it's responsive. And what the CDC does list, if you'll go back, sorry, I know you're advancing and right there, this statement at the top related to monitoring those factors to guide the decisions at the local level. And so that's what was reflected there, is reflective of the CDC, and certainly does not put us in a position where we would not be masking during a period of high transmission inside of our schools.
So what you're saying is that we are in compliance currently with what the CDC recommendation is, and we will continue to comply. Is that right?
Correct. What's brought forward here allows us, in our view, to continue to be compliant with that, because the CDC recommendations talk about layered mitigation, the local level, and using these decision-making factors to determine local plans for mitigation. And broadly, as Mrs. Ogburn pointed out, the CDC has stated their general the position related to masking in schools remains as what has been stated since I believe it was the July-August timeframe related to when we saw them make that change to make this recommendation during cases of high transmission.
Can you come back to me? Let me,
Yes, sir.
thank you.
Ms. Kinsella, do you have the information you need to make a decision today?
I believe I do. I mean, we asked for a plan. We asked if the committee was talking about a plan. The plan is now here. We even talked about the last meeting, though a lot of folks missed it. I'm very excited about it. It's transition. It's not a pivot, which I think is, and it follows what's safest and best for Henrico County. Henrico County schools specifically, our students and our employees. So I have what I need. Thank you for this plan. And thank you for the, as Ms. Ogburton said, the metrics, the actual numbers. And I appreciate your question too, Reverend Cooper, because I wanted to be sure, well, I asked already if the dashboard and the definitions and things have changed along the way. And I've often had to reconcile the rhetoric. So if we feel comfortable with this, and Dr. Cashwell said she did, then yes, I have enough information to move forward.
Thank you, Ms. Kinsella. Ms.
If I could just add, communication is key. Like, this is not happening today, but this is the plan, right? Like, just want to say that, communicating this to our community.
Yeah, we are currently not at the level of transmission.
Correct.
Correct.
But this is the transition plan.
Correct.
It's not a pivot.
Yeah,
It's a transition.
Not only does this not reflect where we are today, that certainly it's a proposal we've made to the board based on your request to see what specifically would be the point in time or the moment where we would recommend off-ramping from the universal masking. Of course, we mentioned a lot of exceptions related to specific cases like returning from isolation. And then so we would certainly await direction from the board related to how you would want us to proceed. And based on the board's decision, would communicate with our stakeholders effectively. And at this moment, it's a discussion, and it is just that. And so, should it be something we move forward with more formally, then we'd communicate it.
Okay, thank you.
Thank you. Ms. Atkins, do you have the information you need to make a decision today?
I'm going to ask one more question, and I think I'll be able to answer your question. So if I may, I just want to be clear one more time that there will be exceptions to the rule. And when those exceptions happen, what does that process look like?
Well, I think the only specific exceptions I can think of are related to specific cases we've mentioned already. And so first of all, if we would move away from universal masking because all of these conditions were met, individuals may still choose to wear a mask. We may have some who choose not to. This would not apply to adults in our buildings, our staff. We mentioned that the dolly regulations, it would not apply to buses, assuming the federal order were still in place, and it is. So we have to, I don't know how far in the future it would be that these conditions might be met, but assuming that we're still in place, that would be an exception. If a student were to be a positive case of COVID and isolate and return, and so they would need to return wearing the face covering. Again, that's current health commissioner guidance and in alignment with the recommendations for VDH. And so those cases would still be applicable. They are today, and they would be even if we were to move in this direction.
Thank you. And then the other question, Chairwoman Shea, is I just want to be very clear that are we going to vote on this after we share these remarks?
So if it's the will of the board and at least 3 board members are prepared to make a decision today, then we will take a vote on it.
Today?
Yes.
Okay.
And if any information is needed, we're happy to, both Dr. Teigen and myself, staff, provide any additional information responsive to any additional questions or needs the board has related to this topic.
And so I do feel that communities deserve the opportunity to digest this. I also want to speak for several employees to have the opportunity to digest this with the understanding that I am on the health committee and this has been a long time coming. And I am, like I said before, excited to be here. But it is not lost on me that it's taken this long to get here. So in a matter of 30 minutes or an hour to switch and vote without getting the public's input, whether you're a person that want masks gone yesterday or a person that never want masks to go away. I don't think there are very many. But there are many that certainly are immunocompromised and have their opinions on wanting to wear their mask. And then there are our students. There are many students that are holding on to this mask like Linus hold on to their blanket because of some of the mental things that they've developed over time. So to vote on this and not give our students a voice, to vote on this and not give our Henrico County Public School employees the opportunity to even talk about what their options are and if they're uncomfortable, to not give the individuals that I spoke with that said, you know what, Ms. Atkins' mask should be gone yesterday, but not to give them the opportunity to look at the specific science behind what we're doing. I am uncomfortable with. However, what I will say is this is a wonderful decision-making tool, and that as long as it's agreed upon that in certain districts, I'm speaking for mine, if we are in a situation where we feel that we want an exception to this rule, that would be considered. So that is my response.
I'm sorry, I missed the very last, which was the most, part of the most important. Can you repeat your very last sentence?
No, Dr. Cashwell and Dr. Teichen have both spoke to it, but I just want to say it one more time for the record that as I believe in this, I shared my concern around that one section and the weight of it, and they both confirmed that they will consider exceptions to this rule, and I'm just speaking on behalf of Highland Springs, Sanson, and Varina, where some of this just may not be a good fit. And I'm saying that because folks haven't had an opportunity to weigh in. They're seeing this for the first time, just like many of I am. So having to process all of this in a matter of an hour and then vote on it, knowing that it took 2 years to even get here, I don't feel happy about. But I do know that progress comes sometimes with some sacrifice. So that is my statement on the record, just making sure that it will be considered that in my district, we may not fit this model all the time. So thank you so much.
So specifically, do you have the information you need to make a decision today?
No.
Thank you. Reverend Cooper?
So I want to make sure that right now we are not changing our current policy pertaining to universal masking. Is that correct? Dr. Cashwell?
Certainly only the board could make that decision as you implemented that in August, and your policy still holds related to universal masking until the board decides otherwise.
And so for me, thank you for that statement, because I don't want there to be any misunderstanding that we are voting today saying that we are removing universal masking. We are not removing universal masking. What we are saying is we have developed the criteria, we have developed the metric that we will use to determine if we are removing universal masking aligned with what possibly might come down from the state. Is that correct?
Yes, I think that captures it. What we've shared with the board at the board's request is a target, if you will, a scenario might be the right word for when we might recommend the board consider moving away from universal masking that is responsive to CDC, has to take us out of high transmission. We are not out of high transmission today. And so I think if this is forecasting, if you will, for a time when that would be possible.
Which again is nebulous because we don't know. It could be months, depending upon SB 739, if that changes.
And that's correct. I mean, I think to your first question is if a law is passed before any of these 4 checks would be achieved, does that matter? Well, we would follow the law that was passed at the time the law became effective. So yes.
Well, so Madam Chair, I am comfortable accepting this formula. I mean, in regards to what we're saying, that this is not removing it right now. It is not saying our policy is changing. We are going to take into consideration what the state says in regards to SB 739. And this is just a targeted metric that we will use to have a definitive kind of direction to go in to remove the ambiguity. So yes, I'm fine with it.
Thank you, Reverend Cooper. I also I think it's important for our community, wherever they fall on the spectrum of masks, to understand where we're moving and how we are getting there. And I think this provides it. Again, as Reverend Cooper so beautifully pointed out, there's still a lot of unknowns that could come from the state or elsewhere that could change this, but I think it's so important for our community to not feel like it fell from the sky. And so this gives them the understanding of where we're headed and how. And so I am a yes also as to, and so it sounds like it's the will of the board, with the majority of the board having the information they need to make a decision today. With that being said, is there a motion to adopt this student masking transition target as presented?
That can certainly be your motion, Mrs. Shea, or someone can make that their motion if that's what it all is in the way that you're phrasing it. So
Thank you. So thank you, legal counsel. So is there a motion to adopt this student masking transition target slide as presented?
Mrs. Shea, I'd like to make a motion that the school would approve the student masking transition target as outlined.
Thank you, Mrs. Ogburn, for the motion. Is there a second?
Second.
Seconded by Mrs. Kinsella. All in favor for adopting this student masking transition target as presented, please say aye.
Aye.
And I am an aye. All opposed, please say nay. Any abstentions? The ayes have it. This student masking transition target has been adopted. As a follow-up, board members, is there a motion to give Dr. Cashwell the authority to enact this student masking transition target when we meet these 4 check marks without having to call a special meeting or a separate board vote? Is there a motion?
I move that Dr. Cashwell has the operational authority to follow the student masking transition target that the board just approved.
Thank you for that motion, Mrs. Kinsella. Is there a second?
Second.
Seconded by Reverend Cooper. All in favor, aye.
Aye.
I am an aye. Any nays? Any abstentions? The ayes have it. Dr. Cashwell has the authority to enact the student masking transition target plan as adopted.
All right. I think Dr. Tigan thank you for your patience. I've noticed how long she's been at the podium through all of that, so thank you, Dr. Tigan. Thank you again to the staff, the members of the committee who continue to guide us as we are in current practice and thinking to the future.